Welcome to all our guests this evening. Welcome to Personal Conversations, one of several educational programs which are a benefit for members of Women's League for Conservative Judaism. In the Personal Conversations series, we try to take a deeper look into current issues of special concern to us as Jews and as women. We're delighted to have a large audience from across the US and Canada here with us. I'm Vivian Lieber, the chair of Women's League's Personal Conversations series. The prior sessions in this series may be replayed from the WLCJ.org website under the Programs tab. Tonight's program will run for an hour and a half and is being recorded. Karen Belena of Women's League is providing support on the Zoom platform. Thank you, Karen. By tomorrow, the link of this recording will be posted on WLCJ.org, usually in the news tab on the homepage, later on the programs page. So April is National Donate Life Month. Today's conversation is entitled Organ Donation Out of the Shadows, and it's subtitled, Are We Each Responsible? We'll explore the types of transplants, societal obstacles, the medical and psychological considerations to donor and recipient, families, the rabbinical teachings and stance within conservative Judaism. And we'll hear the personal accounts of several people who've directly lived the experience, one a recipient and her living donor, and one a father who confronted the worst tragedy. They each chose the mitzvah of organ donation and experienced the infinite gratitude that accompanies it. The order of presenters will be, and they'll each be introduced further as they're about to begin, Dr. Amy Friedman, Dr. Michael Cainer, Jeanette Brownstein, and Rabbi Elliot Dorff. And to close the program, Rabbi Ellen Wallins Fields of Women's League. Now it's my pleasure to first introduce Debbie Goldich, Women's League International President.
Thank you, Vivian. It's wonderful to be together tonight to hear and to learn. We in Women's League are very proud of the programs that we provide that offer you, the members, opportunities for learning and engagement. And tonight is one of those programs. I want to thank Vivian Lieber, who created this program tonight, supported by Gail Budiansky, and the education co-chairs, Ellen Cainer-Bresnick and Julia Loeb, and all of you who come on every night and support us in our programs. So thank you so much to everyone, and I look forward to learning with you tonight.
Thank you, Debbie. You may reach me personally anytime later with questions or with ideas for future personal conversations. My email address is vlieber@wlcj.org. Now, for this program, the chat box will open at certain times for questions from the speaker. First, after the first two speakers, very brief, for brief Q&A, and later after the final two speakers. Please, at that time, address your questions to Debbie Goldich, you'll find from the chat box, and she will select a few questions as time permits. We also have links to resources that'll be emailed to individuals who registered for the program, and we'll tell you more about it. There's also a booklet containing personal stories of other Women's League members and their own journey with organ donation as recipients, donors, or family. Our first presenter today, who I am delighted to introduce, is Dr. Amy Friedman. Let me tell you a little bit about Amy. Dr. Friedman, welcome. Dr. Amy L. Friedman is a transplant surgeon and the Chief Medical Officer, Executive Vice President of Live On, New York. A Brooklynite at heart, she received her undergraduate degree in biology from Princeton University, her MD in general surgery training from Downstate Medical Center, SUNY in Brooklyn, and her training in transplant surgery at the U of Pennsylvania. She's been on the faculties of the University of Pennsylvania, the Yale University School of Medicine, and SUNY Upstate Medical University. Her work to improve patient safety and quality in organ donation and transplantation has led to multiple grants and publications. She also serves on the opt-in UNOS Ethics Committee. Welcome, Dr. Friedman.
Thank you so much, Vivian. And I really want to thank everybody for the privilege of joining you tonight. Talking about transplant is very difficult to really pack an adequate amount of information into the 20 minutes that I have, but I'm going to do my best to do it. Realize that we've now been actively transplanting in the world for 67 years. The first transplant was done in 1954, and it was a transplant of a kidney between identical twin brothers. I'm not going to go through all of the history, but in those 67 years, we've now evolved to the point that we have two types of transplants. You can have a living donor transplant, and while it used to have to be initially an identical twin and then a family member, our ability to prevent rejection has become so good that you don't even need to be related to be, there doesn't need to be a genetic relationship between the donor and the recipient anymore, because we're able to prevent rejection. So live donor transplants of kidneys, livers, and lungs are possible. But the vast majority of transplants that are done are from what we call deceased donors. I'm going to very briefly tell you about the terminology that I'm using tonight, because a few years ago, donor families asked us to specifically change our terminology. We no longer talk about harvesting organs. We talk about recovery or procurement of organs. And we don't talk about cadaver donors, we talk about deceased donors. And this is easy enough for us to do to show the respect to those heroic people who became donors. So I just turned you all into ambassadors, and now you will use the correct terminology, I know that. So in the deceased donor field, which is the vast majority of transplants, I'm keeping an eye on my notes because I don't want to forget anything in this rapid fire session. We do hearts, lungs, liver, pancreas, liver, I told you, small intestine, kidneys, and now we also do face, hands, uterus, and penis transplants. So it's exploded in those last 67 years. And the key part that not only facilitated this explosion and expansion are a couple of things. First of all, medical care has generally advanced so vastly that we can support a person while they don't have a heart in them. We can support a person, keep them alive while they don't have a liver in them, because that's an integral part of having a transplant of a heart. At some point, your old one comes out and a new one has to go in, and there's a period of time when there is no heart. So those advances needed to be developed. And then the good ability to prevent rejection without killing the individual because they were taking so many medications that they didn't have an immune response to cancer or to infection. And that's really dramatically improved over the years. And the key part here is that we have a tremendous shortage of organs now because we've become so good at what we do that so many more people are appropriate candidates for transplants. And in the United States, there are now currently, and I checked this morning, 107,926 people on the waiting list for deceased donor organs. 85 to 90% of those are in need of kidneys because kidney failure is so much more common than the other types of organs. And in Canada, I have updated the information for myself today, and I haven't been that fluent with all the Canadian statistics, but I'm going to try and keep them fresh as well. There are about 5,000 people on the waiting list. Now, we will only, let's say in the United States, there were 35,000 total transplants in 2020, and this was a peak number. This is the most that has ever happened, 35,000. But wait a minute, we have more than 105,000 people in need of transplants. And I'll give you another statistic, and I don't want to bog this down too much with data, but every day in the United States, 20 people die on the waiting list who might have been saved had there been an organ available. So these mathematical equations are very simple to do, and they're horrible if you're in need of a transplant. In fact, if you're in New York and you need a kidney and you're seeking a kidney transplant, you will wait on average 6 to 10 years. The mortality while you're waiting on dialysis every year is between 5 and 10%. So yes, many people do not survive the wait to getting a kidney transplant. And I understand that in Canada, the wait is 2 to 7 years for a kidney. These are terrible data. The most important thing that you can do before I kind of explain what the whole system is to choose and opt to be a donor and to make your wish known in advance. You can do that by joining the registry. Now, when I say the registry, that's a little bit of a misnomer because in fact, in the United States, there are 51 different registries. We haven't quite overcome the technology challenge. Each state has its own registry, and there is a national registry from the organization called Donate Life America. So if you are in the United States, please write this down. You can join the national registry by going to donatelife.net, donatelife.net. Certainly if you're in New York, you see the initials for my organization, Live on New York. You can go to liveonny.org. And in Canada, as best I could tell, you go to canada.ca. In the United States, about 60% of Americans are registered to become organ donors. Now, in New York, it's only 42%, and that's a disaster. And we have the lowest registration rate in the entire country. And there's so many reasons for it, but it doesn't make sense because we have actually almost a tenth of the entire waiting list located in New York waiting for organs. So disproportionate number of deaths because we don't have enough organs and we have relatively a high number of people that need the organs. So what I wanted to do is try to help you understand what the system is, because even though I was in clinical transplantation practice for, I'm not going to tell you how many years because you're all smart and you can do the math and that's none of your business. But so I was a clinical transplant surgeon for many years. And I did not understand all the nuances of the system until I joined the organization that I'm with now called Live on New York 7.5 years ago. And what we are is called an Organ Procurement Organization, or OPO. There are 58 OPOs in the country. We do not compete with each other. And the service area for my particular OPO is the greater New York metropolitan area. So figure that's 13.5 million people, 98 or so hospitals, 11 transplant programs, and a tenth of the national waiting list for organs. A disaster. Now, here's the way the system works. When you are in a hospital that accepts Medicare, that participates with Medicare, and all hospitals have to because there's so much of the funding that comes from Medicare. So that's really every acute care hospital in the United States. A condition for them to participate in Medicare is that they have to cooperate and facilitate organ donation. And what that means is they are required to refer to their OPO every person who dies or is imminently going to die, expected to die in their hospital. This is not optional. It is not a choice of the particular doctor or nurse. It is a requirement of the hospital that the relative or the relevant OPO, Organ Procurement Organization, be contacted. Each hospital in the country has an agreement with one OPO. So there is no competition within a hospital for the patients that have died, et cetera. It is very clear, it's all distinguished in advance. So if you are in a hospital and unfortunately die, then the appropriate OPO is notified. Now, what people also don't understand is that HIPAA, the Privacy Act for medical information, it has a specific exemption for OPOs and for organ donation information. So not only is the staff supposed to tell us about the information, are they permitted to give us the dead person's or dying patient's information, they are required to do that by the hospital. And actually, a lot of medical staff and hospital staff don't really understand that point. And I didn't understand it until I joined the OPO. So there's a lot that seems very mysterious. Now, what will then happen is that behind the scenes, the OPO staff, and that would be me at the very end point of the information that's transmitted to us, will hear the information about the patient and determine with an initial triage or screening step whether the person may be a suitable donor or not. And if it appears that they may be a suitable donor, then one of our staff members goes on site to the hospital, interacts with the hospital personnel to get more information about the potential suitability of the patient, to give information to the staff about what organs might be suitable for donation, and then learns about what's going on with the family. Now, the other thing that we do, and we are the only people that can do it, is we will check the registry to determine if this person has already given legal consent for donation. Hospital staff can't do that. And if you think, well, it's on my wallet and it's on my driver's license in my wallet, well, who actually has the wallet and who goes through that in a hospital? So that's the privilege that we have. And we do that for every single patient who's referred to us. If you are on the registry, it is already legal consent for donation. And that relieves a burden from the family about having to decide whether or not donation might be appropriate. In fact, what we will do then, once the patient has died, is brain death, is we will say, your loved one has given consent for donation. So instead of asking for permission, we are notifying the family, and we ask, what do we need to know about your loved one to make it as safe as possible for the recipients? And that's a very important difference. So I would urge everybody to consider registering to be a donor. And the next most important step is make sure your family knows your wishes, because we do not want to be in a fight with the family, certainly at the point of grieving, et cetera, and a sudden death, et cetera. It's the worst thing in the world is to have to fight with people. And so make your wishes known. And the final point, because I don't want to expand too much beyond the time that I'm permitted, the final point is, please understand that it is appropriate for everybody to register. We don't want you to make the selection, oh, I think I'm too old to be a donor. In fact, we've used a 93-year-old donor's liver that was transplanted into a 67-year-old person who left the hospital in 6 days with excellent liver function. And it's now 5 years ago that happened, and the recipient is still alive. So you're not too old to be a potential donor. Sure, we'll accept fewer older donors, but let us make the selection. It used to be that HIV was a contraindication to donation. It was actually against the law. And now there is a new law that was passed in it's not so new now, 2013, called the HOPE Act, to make it specifically legal to transplant HIV positive organs into HIV recipients. So the most important message I can say is, please don't make a selection. Be generous, because we will not use the organs if they're not appropriate. Please register so that we can make the selection. And again, I want to say that the way to register is donatelife.net, or you can go to our website, liveonny.org. And in Canada, it's canada.ca is the government site, and it's very easy to find the pathway within that site. So I think I've kind of gotten to the end of my time, Vivian, is that correct?
You can have 2 minutes more.
Oh, 2 minutes, okay.
We're hungry for this information you have.
Okay, so I do want to share some of the most exciting stuff that's happening. New York has now had 3 face transplants performed. The last one was actually the first in the world to be a simultaneous face and 2 hands that were transplanted. That young man, Joe, and this is all public information, Joe was in a terrible car accident and had dramatically horrible burns to his face. His hands were all contracted. He couldn't use them. And this was about 6 months ago, and he's now swinging a golf club with those transplanted hands. Really pretty amazing. COVID has been a very major challenge for us, and I'm sure you've heard about the case in the news where COVID lungs were transplanted into a recipient who died as a result from COVID, and actually the transplanting surgeon also became COVID positive but did not die. He did okay. But we're very clever. We're trying to really expand the suitability of donors because we just have such a severe shortage. Again, 20 people dying every day in the United States because there is a shortage. So I will tell you that we've just transplanted organs. This was very recently from a very, very newly infected COVID patient. We did not use the lungs. We used the heart, the liver, and the kidneys. The donor was treated with the monoclonal antibody. The recipients were treated with the monoclonal antibody. And so far, and it's looking really promising, nobody has received COVID. And obviously, this is done under very, very careful consideration and with absolutely informed consent of the recipients. So we're very, we are scrupulous. If there is any potential for donation and we have authorization, we will go forward. So give us the opportunity.
Thank you.
Sure.
I learned a lot just now, and you're doing wonderful work. Thank you very much. I also want to mention that Dr. Friedman is the first cousin of Corey Schneider, our past president. And they grew up in a close-knit family, I'm told.
Well, that's right. And I'll just add,
Corey is with us this evening, so.
And I'll just say within our own family, we have 2 kidney transplant recipients and a third patient, a third family member who was on dialysis. So this touches all of us very commonly.
Yes. Thank you so much, Dr. Friedman. So now we're going to shortly, after the next speaker, actually have a very short Q&A session. So if you want to start typing a question into the chat box, even if you type generally, it'll be forwarded to Debbie or send it to Debbie, and we'll have time for a handful of questions after the next speaker. So with that, I'd like to welcome, we're very fortunate to have here today, Dr. Michael Cainer. He has a personal story to share with us, and his sister, he has 2 sisters with us tonight, Debbie Goldich and Ellen Bresnick. Ellen is Women's League's co-chair of the education team. She'll introduce her brother. Isn't that great?
Thank you, Vivian. It is my great honor to introduce our next speaker, Dr. Michael Cainer, who'll tell about his experience with organ donation, which unfortunately came about when his oldest child, Max, died after what was supposed to be a routine procedure. Dr. Cainer graduated from Tufts University School of Dentistry and completed a 1-year general practice residency. He's been in private practice in suburban Philadelphia for the past 35 years. A past president of the Pennsylvania Academy of General Dentistry, he is a national trustee of the organization and has earned mastership in the academy. He has lectured nationally and authored over 25 articles on various dental subjects. Dr. Cainer is a trained forensic dentist and is part of DMORT, the Federal Disaster Response Team. He was part of the team that identified those killed on 9/11. He worked at the crash site in Somerset County, Pennsylvania, and he went up there that night of 9/11, where Flight 93 crashed, and later spent every week on the following year, 1 day a week, at the medical examiner's office in New York City, identifying more victims. In addition, he spent 2 weeks in Mississippi after Katrina, helping to identify the victims of the hurricane, and recently spent time in New York City identifying COVID victims. A licensed attorney as well, Dr. Cainer is on the teaching staff of Sacred Heart Hospital in Allentown, Pennsylvania, where he did his residency and helps train the dental residents in the program. He lives in Bucks County with his wife. He has 2 adult sons, one an attorney and the other one who served as a paratrooper in the IDF. I am really proud, extremely so, to introduce my brother, Dr. Michael Cainer. Michael?
Thank you, Ellen, for that lovely introduction, and to Debbie and to Women's League for allowing me to share Max's story. Ours is the American dream that turned into a nightmare with the silver lining of organ donation. At the time, my wife was and is an attorney who was with the district attorney's office, and I was a young dentist who just bought a building and was moving my practice in 2 weeks' time. Max was our firstborn, named my wife's grandfather. Max went in for what was supposed to be a routine surgery. 24 hours post-op, he suffered a massive hemorrhage at home and a large blood clot blocked his airway. I did CPR, but by the time the blockage was cleared, he had been without oxygen long enough to be declared brain dead. In Pennsylvania, two electroencephalogram, two EEG tests required 12 hours apart to make the confirmation of death. To a medical person and knowledgeable, like each of my sisters, if you say pupils are fixed and dilated, they understand the ramifications and the brain death implications. Some non-medical people, sometimes you have to explain that the person is not just unconscious, but they're never waking up, and the ventilator is breathing for them. And without it, their heart will soon stop. That, to many, is the biggest barrier to donation, when a family doesn't understand the concept of brain death as actual death. In our case, we understood the gravity of the situation very early on, and the coordinators and administrators did not need to educate us. I had actually taken an overhead light in the emergency room, put it in Max's eyes, and when the pupils didn't change, I knew how bad it was, and I explained the situation to my wife, Barbara. For us, the decision to donate Max's organs was a foregone conclusion. In our case, Barbara and I had both had organ donors on our license from the first time it was available, so it was an easy decision for us to make, especially since we were the ones who reached out to the hospital and asked to donate. Based on the circumstances of Max's situation and the fact that we were in the hospital where the surgery had been done, I don't think they would have approached us asking about donation. Pennsylvania, as like the program that Dr. Friedman had mentioned on the federal level, has what's called Act 102. It was signed by a previous governor who was both himself a recipient of a heart and a liver transplant, and it requires the hospitals to reach out to families about potential donation if the person is a viable candidate. At the time of Max's death, this was not the case. As I said, we actually broached the subject of organ donation, and within 20 minutes, a trained coordinator was there to guide us through the process. Max helped save 5 lives with both of his kidneys donated, heart valves, and liver and small intestine donation. It was only the second time that a liver and a small intestine had been donated in this country. And they had to track us down at the funeral home because we had signed off for all the other organs and they did not ask us about the small intestine. Excuse me. Usually donation is an anonymous process, but we found out who one of the recipients was because it was a high profile case in Pittsburgh where the mother of the recipient had gone on television requesting donors and promoting organ donation beforehand. One of our friends living there read of the case of a 2-year-old who passed away in Philadelphia and donated his organs, and it didn't take much for him to connect the dots, what was going on. He waited a month and then asked us if we wanted to know the details. Unfortunately, that child passed away 3 months later from unrelated to the transplant. We then reached out to the family and received a heartfelt letter from them, thanking us and explained how we allowed them to have 3 more months with their child that they would not have otherwise. Not every death can be an organ donor. For most organs, the person has to be on a life support to keep the organs perfused with oxygen and prevent the degradation. If not, usually just cornea, skin, bone can be used. Philadelphia, where the Howard Nathan has run the Gift of Life, the OPO, the Organ Procurement Organization, for 40+ years. And it's often the national leader in the number of organs donated and donors and are on a per capita basis because of the programs, the training of the coordinators, and the Act 102. At the time, they used the concept of decoupling, where one healthcare provider informs the family that their loved one is brain dead and dead, and another individual approaches them vis-a-vis organ donation. This avoids the perception of a family being told, oh, your loved one's dead, you want to donate their organs. However, recent research has shown a higher donation rate when families have been approached before their loved one has been declared dead and the subject of organ donation has been raised. It gives them time to think about it and make the right decision for them. Decoupling or not every situation is the same, and that's where the coordinators come into play, to read the family dynamics, ascertain who are the decision makers, what concerns do they have, and is there unanimity in a family decision? And do they understand the concept of brain death as death, despite the ventilator working? More importantly, is the person approaching the family, have they been trained? They have to answer the questions. And in our case, The two that we had were, would it impact his funeral or delay it? Max was declared dead on a Sunday, and we wanted to be able to bury him ritually on Monday. And they were able to facilitate the fact that he was able to donate his organs and be buried the next day. And the other question is, would it affect how he would look in the casket in the open? And the answer is, it would not affect at all. You cannot tell. Every family dynamic is different. And even if, as Dr. Friedman said, a deceased wishes are known via a licensed designation, the OPO, the Organ Procurement Organization, will not take the organs if a family objects. This prevents the optics of bad public relations or a legal battle. The best advice is to tell your family your wishes and try to make sure in advance that they follow them. The time to discuss organ donation is over the dinner table, not at the side of a hospital bed. Making your wishes known explicitly saves a family from the agonizing decision of trying to ascertain your wishes. A living will, medical power of attorney, memorializes your wishes as does the license designation. The downside of not letting your family know is that they may let the organs be buried where they could be used to save lives and cut down that waiting list that Dr. Friedman alluded to. It can often be the silver lining in a tragedy that affects the entire family, from the immediate family to cousins to aunts and uncles. And in our case, that weekend, that horrible weekend, all the grandparents, all the aunts and uncles and siblings and spouses were at the hospital. 2 years later, and 3 days after our youngest son's birth, my father-in-law died very suddenly. And my mother-in-law, herself a nurse, said she wanted to donate his corneas as the other organs were not able to be donated. I was in the hospital ER, and I was designated the one to ask on her behalf. And I asked the hospital to contact the OPO, and they didn't seem to be doing anything. And I was afraid the organ donation wouldn't occur. In the middle of the ER, I got on a phone, and in my very Cainer way, loudly and in front of the entire staff, contacted the OPO, explained the situation, and very soon after, a representative was there to facilitate the donation. For my mother-in-law, this was making the best of a bad situation and a silver lining for her. Organ donation affects the entire family. We've been blessed with 2 other sons who are now grown and have taken it upon themselves to promote organ donation. From their bar mitzvah projects to college fraternity social action programs and fundraisers to where they raised awareness and got the topic discussed and people to think about it before it was in crisis mode. Organ donation now has less controversy, but back then it was not without those who objected. My wife and I subscribe to the concept of nefesh, saving lives if possible. As I said, our extended family had been there that whole weekend at the hospital. And everyone knew the situation, what was going on with Max, and we were donating. And one stranger came up and decided to give us his unsolicited, unwanted, and unneeded opinion. He spoke mostly Hebrew and broken English, and my Hebrew was pretty rusty. And I asked my sister Ellen to confirm what he was saying. But the gist of it was, he was saying what we were doing was a sin and we shouldn't do it. I just walked away. The last thing I wanted to do was to deal with someone at that point. My wife and I knew what we were doing was the right thing, and despite what anybody else thought. I hope those views have changed in recent years and resistance to organ donation is fading. Max's legacy was and is organ donation. Even though he didn't live a long life, he was able to impact others and help promote organ donation. People we don't even know. And I often wonder as I walk around Philadelphia, the person I just passed, were they one of the recipients? It affects people without even realizing it. And 2 events come to mind. When my boys were teenagers, they played Pop Warner football. On picture day, you line up in uniform and they take the picture. While we were waiting, I noticed the photographer had a jacket on that said Transplant Games. Those are the quasi-Olympic games that are held annually for recipients to show how active they are and how healthy they are in competing in Olympic type events. Making small talk, I asked his affiliation with the games, and he asked how I knew about them. And I mentioned I was a parent of a donor. He immediately started tearing up, yelled for his wife to come over, and gave me a huge bear hug in front of 200 confused people and one very embarrassed teenager. Turns out he was a lung recipient. And while he couldn't thank those who had donated to him, he transferred that to me. Secondly, one of my wife's coworkers found herself in a situation which she called gift of life, the OPO in Philadelphia. Her father was about to be declared dead, and there was discussion as to donating his organs. As the oldest of 8 children, her mother had asked her to call the OPO and ask a few questions. When she called, and while she was on hold, she heard a public service announcement that I had recorded for them detailing Max's story. She knew Barbara and she knew of Max, and she went back to her family and said that she felt that was an omen that they should donate. It was 5 years later before she told my wife of these events. Max's death and his organ donation led us to become unintended emissaries. When Act 102, the legislation that Governor Casey signed to increase organ donation was signed, we were asked to go to the bill signing and speak. Told Max's story and how he donated his organs, and it was the only good that came with it. It was picked up locally, and our local newspaper asked to do a story on Max. It was the December holiday season, and they loved doing heart-wrenching stories to promote organ donations for their holiday drive. Well, it must have been a slow news day because Max's picture and story covered 2/3 of the front page of the paper. People who didn't know the story of Max's death and about donation came in and asked us about donation. And we filmed a segment for Japanese TV because donation rates there were extremely low and the government was trying to increase the rate. My wife filmed a segment for ABC National News on organ donation, and we've done other local stories on it to promote Max's legacy and keep his memory alive, and at the same time promote organ donation. To this day, I have patients asking me about organ donation, and we keep literature on organ donation in the reception area. And in the COVID world, it is the only thing in the waiting room. It's the least we can do to promote organ donation and to keep Max's memory and legacy alive. Thank you.
Thank you, Dr. Cainer. That is certainly a moving story, and I'm very sorry for your loss. And we're all going to take this to heart and remember this, your words. Thank you. So if anyone has a question for either, yeah.
I do have 3 questions that were in the chat, Vivian.
Okay.
Very good.
3 questions, and Debbie is
Thank you. So the first question was, what's the age limit of being a donor? But I believe that Dr. Friedman answered that when she told us about a 93-year-old donor. So thank you for that information. Someone asked, does being an organ donor affect your medical care?
The answer is absolutely not, because the team that takes care of you is one team and the OPO team is a separate team, and that is done intentionally so there is no conflict of interest. The other thing you should understand is that if you are not optimally cared for, your organs aren't doing well inside either, and they won't be suitable for donation. So we want you to be best cared for, and there's nothing that makes us happier than when a patient we've been early notified about recovers. You should see us all celebrating. So there is an absolute separation of care.
Okay, thank you, Dr. Friedman. One more question. How many recipients can be helped from one donor?
So the maximum really is 8 organ recipients, and then even more than 50 if there's tissue donation. And that's generally quality of life, although not always, because if there are heart valves, that's really length of life and survival as well. But for what you think about with organs, 8 is the maximum.
Thank you. Okay.
Thank you. Thank you very much, both of you. So it's my pleasure now to introduce Jeanette Brownstein. Let me tell you a little bit about her. Jeanette is completing her 3-year term as Women's League Florida Region Torah Fund Vice President. She'll be installed as the Florida Region's president in early April. Jeanette recently moved to South Florida from the Orlando area, where she was also the Torah Fund co-chairperson and for the Sisterhood Congregation of Hev Shalom in Maitland. She is a social worker by training and recently retired from Jewish Family Services of Greater Orlando, where she was the director of programs. Jeanette and her husband Stephen's careers as social workers and Jewish communal professionals have awarded them the privilege of working in many Jewish communities across the US and Canada. Jeanette?
Thank you, Vivian. I'm so honored to be part of this panel with such esteemed professionals, but to follow you, Dr. Cainer, is so humbling. I cannot even imagine the pain of your loss, and then to make a decision of such love for your pain and anguish is beyond whatever should be expected from any parent. May your son's memory always be for a blessing. 15 years ago this week, I received the gift of life from a living donor. In fact, a gift of life from a sister from the sisterhood of my congregation at that time, a gift, a mitzvah for which there are no words to properly describe. Since that day, I take every opportunity to turn a genetic disease some would consider a curse into a blessing and to educate about organ donation. This is not the first time that my donor and I have told our story, and will definitely not be the last. We tell our story in order to educate most specifically about the need for all of us to consider making the commitment to become organ donors upon our deaths. Our goal of sharing our story is, as my donor has said many times, for this to become dinner table conversation or kiddish luncheon conversation for when that day returns. It's not a morbid discussion of death, but rather a discussion about how we choose to live today, tomorrow, and beyond our last breath. As we know, pikuach nefesh, the saving of life, is considered to be one of Judaism's highest values. 15 years, and other than one medication issue a few years ago, I have been living a healthy, productive, busy life because I received this incredible gift. So let me share a portion of my journey to help you understand why I am so passionate about asking you to consider making a commitment to become an organ donor. After a routine physical in my mid-20s, I was diagnosed with a genetic kidney disease. I feel fortunate that the disease didn't affect how I have lived my life as I continued my career, married, had children, and raised my family. Over many years, there was a slow decline in my kidney function, but eventually it declined to the point that I needed to register for a transplant. I approached this news the way I do everything in life, optimistically and goal-driven. My name was eventually placed on the UNOS, the United Network of Organ Sharing list at that time. At this point, I still felt very healthy, but my test results said otherwise. I just continued my life as usual, thinking that this would be a long wait and that eventually I would have to make dialysis part of my everyday routine. But there was one more step. The social worker at the transplant center encouraged me to seek out a living donor. This, by far, was one of the most difficult parts of the entire process for me, as it was the most difficult part of the entire process for me. Asking anyone, family included, to consider becoming a living donor was indescribably difficult. No one in my immediate family was a match. I told my closest family and friends my situation, and then composed a family and friends email and pushed myself to hit send. I began to speak openly about my situation, including sharing with my sisterhood board during Good and Welfare, certainly not expecting anyone to come forward, but hoping people would spread the word about my need. And they did. As my husband was willing to be a donor but not a match, we researched the living donor paired kidney exchange programs, which at that time were not as well known as today, and started the registration process for Johns Hopkins. Before we could complete this, a very dear friend and colleague volunteered to be tested. Although I'm an eternal optimist, I certainly didn't expect the first person that stepped forward to be a match, but she was. After extensive testing, though, she was ultimately eliminated as a potential donor. So I moved forward, continued with my normal routines, and was fortunate to continue to feel healthy while my name remained on the UNOS list. And then I ran into Renee at the synagogue. She inquired about my friend that was being tested as a potential donor. Upon hearing that she was eliminated, Renee confirmed my blood type and without hesitation announced, "I can do it." She really did say this. "What do I need to do?" Of course, the first thing I said was that she needed to speak with her husband. Within a day, Renee was at the transplant center being tested. To make a very, very long story shorter, I did have a brief period of dialysis during the final testing time and waiting for the surgery date, but it was a minor inconvenience. I continued to work during that time as well. Even the date of the surgery was beshert. My daughter was home on her spring break from JTS's List College and speaking at our Sisterhood's Torah Fund luncheon that very weekend. And my son was in town for a work-related conference. Renee's daughter was also coming home from her studies at JTS's Davidson School of Jewish Education. Everything went smoothly and easily for me through surgery and recuperation. Renee had a bit more difficulty than I did immediately following surgery due to a surprise medication allergic reaction, but returned to work within a couple of weeks, bought a kayak, became a certified scuba diver, went horseback riding, went whitewater rafting, went skydiving for a special birthday, much to my angst, watched her children marry and become parents, and much, much more. As I said before, I'm a very blessed individual and very grateful every day. I hope that by sharing our story, others in similar situations will be able to say the same thing because they also will receive the gift of life through organ donation. Our story is one example of making choices regarding organ donation. I don't expect for each of you to necessarily consider becoming a living donor to someone you know or an altruistic donor to a stranger, but to certainly consider registering to be a donor, as Dr. Friedman said, through donatelife.net, and also noting on a driver's license your intentions that will allow you to give life to others at the end of your life, and also to encourage others to do the same. For the thousands of people today and in the future whose lives will depend on organ donation, please consider making this commitment. And please, again, as Dr. Friedman said, share your decision with your families. Again, talking about organ donation does not mean talking about death. It is talking about the opportunity to give another person or persons a second chance at life. As Renee has succinctly said to me and others before, life is good, pass it on. So I know you're all wondering who this amazing individual is who stepped forward to perform this incredible mitzvah. You'll be receiving her written remarks, but I'd also like to introduce you to my lifesaver, a very, very special individual in so many ways, and my dear friend, actually now to me, a dear family member, Renee Feynman. Renee, would you like to say a few words?
If you insist, Jeanette. And Jeanette's right. I heard about it, that she needed a kidney from a sisterhood board meeting. She had announced it, and I kind of knew immediately. I really did. You know how like things are meant to be and paths are meant to cross. And I was a very healthy younger woman, and I just knew. And I ran into her in the shul lobby and asked her how but I knew she had a good friend who was going through the testing process. So when I ran into her and asked her how it was going, and she said she had just been disqualified, my first comment was, what's your blood type? And when it was the same blood type, I said, well, let me do it. I just knew, you know how things are meant to be. I just knew it was meant to be. And from that moment on, I was right. I remember the day that the nephrologist told me that I was a good candidate to be a donor. And I really felt thrilled. I felt like I had this incredible opportunity to do a mitzvah. And you know how you feel when you like do a mitzvah for someone, you take them to the airport. You know, you get the opportunity to drive someone and do them a favor. I drove Jeanette to the airport 1 million times in one day. That's what I did. And it's been 15 years. It hasn't affected my life physically. It certainly has affected my life emotionally and mentally. And we have this wonderful connection. And it's been a blessing.
What a beautiful story for both of you. Thank you. Jeanette and Renee, what shared. Thank you so much. And Jeanette continues to educate others. I know that she's very active as an educator too, and organ donation. So let me just pause before we continue. I want to let you know that we have our speakers have contributed certain resources, and we're going to share that with those who've registered as PDFs that will come by email. But I just want to take a moment to introduce what we're doing. Dr. Friedman has a brochure, and I don't know if it's handy for showing it for a moment up on the screen. And then Dr. Cainer has a list of resources that we can put in the chat box, which we didn't do earlier, and that will also be shared. So don't feel you have to scramble, you know, to capture it. It'll be shared with you later. And finally, we have the a brochure that we've a collection of essays that we've assembled from the several other people who we don't have time to introduce to you, who have their personal stories. That's the one I'm mentioning right now, who you can read about their stories as well, including Renee wrote a piece in this as well. So you'll get this. This is the cover. And there's essays from several more individuals who are Women's League Sisterhood members. And do you have Dr. Friedman and Dr. Cainer's pieces available? If not, here we go. These are resources. If you have your phone, snap a picture. That's one way of doing it. Otherwise, you'll get the email if you don't write to me personally. And finally, the Dr. Friedman has a piece that will be shared with you. So here we, no, that's it. Organ, eye, and tissue donation, a conservative Jewish perspective from her organization, Live On New York. Thank you to everyone who's contributed. And now it's my pleasure first to introduce our, Rabbi Dorf is with us, but to introduce him will be Rabbi Ellen Wallins Fields, who knows him very well from her days as a rabbinical student onward. Rabbi Wallins Fields.
Thank you very much. It's truly an honor and a privilege to introduce to you one of my mentors, my right hand at my rabbinical school interview in February of 1994. Literally, Rabbi Dorf sat right there on my right-hand side during my interview. And I'm grateful that he accepted me along with the rest of the committee. And I can now speak to him directly. He answers my phone calls as every rabbi, he answers their phone calls. Rabbi Dr. Elliot Dorf is truly a rabbi's rabbi, a true mensch beyond belief. I have pages of information about him, which I'll read also parts of it, but I just have to tell you that a few weeks ago, the Rabbinical Assembly honored him and his co-chair of the Committee on Jewish Law and Standards. And it was magnificent listening to all the accolades, because so many of us can say that we're where we are today because of Rabbi Dorf's brilliance. In rabbinical school, I was, after he accepted me along with the rest of the committee, I had the honor of being able to sit at the same table with him during the Committee on Jewish Law and Standards meetings, and he was the co-chair then, and he's still the co-chair now, 21 years later, but I get to not only sit at the table as the secretary, but now I'm humbled to be able to sit on the committee with him as a member. A couple of years ago, I visited the Ziegler in California, and I had extra time, and I said, well, if I have extra time here, I'm going to go sit in on one of Dr. Dorf's classes. And I got to listen to Rabbi Dorf teach at the American Jewish University. He's rector and the Saul and Ann Dorf Distinguished Service Professor in Philosophy. For more than 40 years as a visiting professor, he's taught a class on Jewish law at UCLA School of Law. He was awarded the Journal of Law and Religion's Lifetime Achievement Award and holds 4 honorary doctoral degrees. As I said, he's the chair of the Committee on Jewish Law and Standards. He served on the editorial committee of the Eitz Chaim, the commentary that we all use every Shabbat, I'm sure. He's chaired 4 scholarly organizations. I won't name them all. 13 books, and if you don't have at least one of them, you should go look and get one of them. 200 articles, at least 30 Chuvot, responsa of the law committee. He is truly a brilliant man. Why he's with us today: he's one of the leading rabbis in ethics and in medical ethics. And he was served on the ethics committee of Hillary Clinton's healthcare task force in 1993. In 1997 and 1999, he and along with other rabbis testified on behalf of the Jewish tradition on the subjects of human cloning and stem cell research. Just a few of the items that Rabbi Dorf has written about. You will never meet a more brilliant man, and I'm very honored to be able to say that he is with us this evening. So thank you very much, Rabbi Dorf.
Oh dear, I am human. Okay. Uh, just ask my wife, my kids. I've got the usual sorts of problems. It's, all right. But thank you. That was really very sweet. I'm blushing, but whatever. Okay, so let's get into this. First of all, Dr. Cainer, I'm really upset that somebody told you that donating organ is against Jewish law. That person could not be more wrong. And the and as a matter of fact, the Committee on Jewish Law and Standards unanimously approved a rabbinic ruling by the Rabbi Joseph Prauser, I think 20 years ago, that said that it was not only a mitzvah to donate in the sense of mitzvah as being a nice thing to do, but a mitzvah in the sense of being a commandment. In other words, a legal obligation within Jewish law to make your organs available upon your death. And the way that you do that, and we've been talking about it, is there are a number of ways you can do that. I mean, on your driver's license, but as a number of speakers have already said, what's really very important is that you share that with your family. And by the way, not only in regard to organ donation, but if I can expand this for just a little bit, all of your desires in regard to how you want to be treated in the last months, days of your life, you really should fill out an advance directive for healthcare. And the conservative movement has one in which it goes through, nobody knows how you're going to die, right? But you go through, it goes through about 10 common questions that come up as people are dying. And there are two different rabbinic rulings about end-of-life issues that the Committee on Jewish Law and Standards has approved, one by Rabbi Avram Reisner, one by me. Sorry, we agree on about 85% of the issues and disagree on about 15%. So where we agree, though, the choices are in block print. Where I would allow something and he would not, it's in italics. And you can get that. And what you need to do is sit down with somebody who knows what these interventions are about. Because otherwise you won't understand them. I mean, after I helped my mother-in-law make decisions for the health care of my father-in-law as he was dying, but she felt very guilty about the whole thing. And so I helped her fill out her advance directive. And she started out by saying, I want everything, right? So I said, all right, let's do number one. And I explained to her what it would look like. And she said, oh, I wouldn't want that. Then she did number two, oh, I wouldn't want that. It turned out she didn't want any of it, right? She didn't want any of these interventions. What she was worried about was that she would be abandoned in her healthcare if she didn't say she wanted everything, right? But you need to know that doctors now are really quite aware of the fact that saying that you don't want certain things doesn't mean that you don't want other things. And in that kind of, and the reason why, the American reason for why you need to fill out an advance directive is so that you decide what your healthcare will look like even when you're not conscious. But I have to tell you that really doesn't work very often in a healthcare setting, because doctors will ask your relatives what to do, because after you die, you won't sue them, but your relatives might. And doctors don't want to spend time in the court. They're not trained for that. They don't get paid for that. All of those kinds of things. So what you need to do, but you need to fill out an advance directive for a Jewish reason, namely, so that your children and the rest of the members of your family will talk to each other after you die. I've been in the ethics committee at UCLA Medical Center since the 1980s, and I've actually seen a number of cases like this. Mom is dying, right? She has 3 adult children. 2 of them agree with the doctors that life support should be removed and she should start hospice care. But the third one, usually the one who had the worst relationship with mom, says that, we should do everything. And I actually heard one woman like that say to her siblings, Mom and I didn't get along very, very, very well during our lifetime together, but in the end, I saved her and you guys killed her. Now, it's exactly that you want to avoid. So I actually know of a family, you don't really have to do this, but I actually know of a family where where they took the family to Cancun on a vacation, right, on the condition that the adult children would attend a meeting on Tuesday afternoon. And on Tuesday afternoon, they handed out their advance directives. Both members of the couple handed out their advance directives and went through piece by piece, including that they wanted to be organ donors, right? Now, nobody likes to talk about death, let alone, least of all, their own. But Jews know how to deal with, how to interpret texts. We've done that from almost day one, right? I mean, that's in our bloodstream. So if you hand out pieces of paper that have your advance directive, then you can talk about each of these kinds of things, so that whoever it is that is your surrogate decision maker at the end can say, well, look, I may not want these things in my own life, right, when I'm facing that, but you heard mom when she was telling us this stuff. I'm just doing what she said. Now then, you know, once that surrogate decision maker makes the decisions that mom wanted, and of course true for dad as well, right? Then at least that person can say, you know, if your children are not going to talk to each other after you die, it's not going to be because of this, right? It's going to be because of other things. So it's really important. You don't have to go to Cancun to do this, but it's really important to fill out advance directives and then to call a family meeting and hand out copies to each of your adult children, which includes issues of organ transplant. And there, by the way, Rabbi Reisen and I are in perfect agreement. You should enable your organs to be used after you die. When I talk to audiences about this, Jewish audiences, there are usually two issues that come up. One is, well, aren't we supposed to be buried soon after we die? And the answer is yes. But as Dr. Cainer said, having your organs donated after you die does not postpone your burial. And for that matter, as you know, within the Jewish tradition, you're not supposed to be buried in an open casket. You're supposed to be buried in a closed casket, right? So people don't see the way that you look afterward anyway. But the fact of the matter is, as Dr. Cainer said, right, the body will be sewn up, and even if one of the members of the family has to view the body to assert the fact that this is the right person that's being buried, that's true in California. I don't know if it's true in other states. That person will see the body sewn up, and it can happen as little as 24 hours after death. It usually happens more than that because the state has to, you have to go through, you know, you have to get a death certificate and things like that, right? But in any case, being a donor of organs does not in any way, shape, or form delay your burial. That's the first concern that I hear a lot. The other concern I hear a lot is, but don't you have to be buried whole for purposes of resurrection, right? So what I have to tell you here is a little bit of philosophy. First of all, what happens after death, nobody knows because nobody's come to tell us, right? So it's not surprising that our tradition really gives you very different understandings about what happens after death, both in biblical literature and rabbinic literature and in the Middle Ages. So for example, Maimonides believes that we do not have a bodily resurrection altogether, right? And he actually sort of looks down on people who do. Sadio does believe that we have, Sadia Gaon, one of probably the first Jewish philosopher, in writing in the 10th century, does believe that we have bodily resurrection, because after all, he says, if God could create us out of nothing, then to create us out of our remains should be a cinch, right? Should be an easy thing for God to do. But nobody, I mean, I don't want to be, if I'm going to be resurrected in bodily form, I don't want to be resurrected in the form in which I died. Ultimately, that didn't serve me very well at the end, right? Next time around, I'm going to be an Olympic swimmer if I'm going to do this, right? So in any case, God's going to have to do reconstructive surgery on your body if you're going to be resurrected in any case, right? And so if you donate your organs, that will not be a problem for God to resurrect your body, if that's what you believe, okay? So that's not a reason not to make yourself an organ donor. And of course, what is the most important reason is that you're saving people's lives. I mean, nothing short of that. And as long as I'm on this, I might as well also tell you that if you can, you should donate blood 4 or 5 times a year, because that's also saving lives. Now, one of the things that I think is one of the things that's important to understand is that the only place where this becomes at all controversial in terms of Jewish law has to do with heart donations, and that's because it's a question of the moment of death. How do you define the moment of death? But even the chief rabbin of the state of Israel in 1989 allowed organ transplants. And the chief rabbin of the state of Israel is not known for its liberal points of view, right? So so yes, I mean, there is the question of the moment of death, and a heart transplant has to be done very quickly after, for that matter, organ transplants altogether have to be done very quickly after the person dies. But hospitals are used to doing these kinds of things, right? I mean, again, at UCLA, just because I'm on their ethics committee, the place where, as first of all, as Dr. Friedman said, in order to avoid any conflict of interest, the people who are treating you are a completely different team of doctors than the people who are dealing with organ transplants. So you don't have to worry about conflict of interest. The people treating you will do what is in your best interest to the last moment of your life. And being an organ donor will not change that at all. And then the other thing is that, usually when this is happening, the place where they do the organ donation is, you will be wheeled into, if you're going to be an organ donor after you die, you're going to be wheeled into a room that is right next to the place where the transplant will happen, so that it can happen safely and effectively. What about being a donor while you're alive? And we just heard a wonderful story about that. And actually, the first woman who was a president of my conservative synagogue, this conservative synagogue to which I belong, Devorah Kolker, did this in the 1980s for her daughter, who was then, she was in her 50s and her daughter was in her late 20s or 30s, right? And her daughter got another 15 years of life out of that. And Devorah is still alive and kicking, as we say, right? I don't know, and I will not ask how old she is, but you can sort of figure it out. So I mean, it's so the issue, the one issue I think that's important to see here is that, as we've seen very very graphically here from Renee, if it's safe for you to donate a part of your liver or a kidney, then you will. If the doctors say it's safe, they have a lot of experience with this kind of stuff, and you can live a very active life after you donate. So that should not be a concern either if it turns out that you are a match. And by the way, sometimes also for bone marrow donors in terms of cancer patients, right? So by all means, register for these things and do donate blood 4 or 5 times a year if you can. I'm not telling you to do something that I don't do. I do that as well. Although now they have a thing where they can take double the amount, so you only have to go half the number of times. And for a while I was a platelet donor. That's a whole other story, right? But it's you need to do these things because these things really do save lives. And pikuach nefesh really is an overwhelming value for us over virtually everything else. I want to just tell you, there's one, I was asked to tell you one sort of hard thing. One thing at UCLA that we did not allow, we had a very, very intense conversation about this. As it happens, the afternoon before I got the letter, the Vivian's email asking me to be part of this. We were dealing with what about organ donation from an unrepresented patient? That is somebody who has no living will and has no known relatives. And that was it was a really hard issue because on the one hand, in California, as everywhere else, there's a real shortage of organs. And so the transplant people really wanted to be able to use the organs of somebody who was dying after that person died, even though that person was unrepresented. And we did not know that person's wishes, right? But the ethics committee decided that we could not do that because we really do have to have the consent of the person who is donating, and or at least the surrogate consent of that person's family members. And when that is not possible, then at least the ethics committee at UCLA decided that we could not take those organs. We could not recover those organs. Let me just tell you one sort of funny story, because this kind of thing really does happen. I was about 20 years ago, I was on a book project on organ donation. And one of the people on it was a psychiatrist from Case Western in Cleveland. And he told the following story, that a 12-year-old girl was having kidney failure, and they did tissue matching and all of that. And it turned out that the best match was her 10-year-old brother. Now, children cannot give consent, legal consent, so it's really going to be up to the parents. Although, depending on the state here, they can give assent, is what it's called, right from usually age 12 to 18. But in any case, the 10-year-old boy couldn't even do that. In any case, the family decided to do this. And 6 years later, the girl is walking across the stage at her high school graduation, and the boy, now 16, gets up and says, "That's my kidney up there." Right. Now, what the psychiatrist was trying to point out was that there is some transference, psychological transference that sometimes happens with people. And as a matter of fact, on that project, one of the people on it was a literature professor who played snippets of Frankenstein and Dr. Jekyll and Mr. Hyde, right? And if you think about those stories, you can understand how, there would be these kinds of transference. But by and large, I mean, that still does not in any way, shape, or form mean that you should not do the transplants. It does mean that in some cases you may need to have some counseling and things like that about that, right? Because the organ is not you, right? I mean, despite those stories, right? The organ is not you. The organ is a piece of biological matter that functions in a certain way, and very often you need to have a replacement. As a matter of fact, one of the people on that book project was a social worker who does a clinical social worker who does this a lot, and she later wrote a book called Spare Parts, in which she talked about how this is really not a matter of changing you and your personality into the other person who's the recipient. This is simply taking a part of you that needs to function in order for that person to live. We're not talking about brain transplants, okay? So so don't worry about any of that. I'm going to stop here so that there's time for answering questions, because I don't want to guess what's on your mind.
Thank you, Rabbi Dr. Dorff.
Okay.
Anyone have questions yet for either?
Oh, I have lots of questions, Vivian.
Oh, great.
Debbie,
Rabbi Dorff.
Debbie, a couple people addressed them to me also, so I have a couple here. They weren't for me, but they're for Rabbi Dorff.
Why don't you send those to me so I can put them in some kind of order, Jeanette, okay?
Okay,
Thank
will
you.
do.
Rabbi Dorff, so there's a question about organ donations. Do they have any effect on Chevra Kadisha?
Thank you for asking. No, not at all. Because people in Chevra Kadisha are by now certainly used to preparing bodies for burial that where there's been an organ donation. But in any case, the body is sewn up, and as far as the people who are treating the body is concerned, many of them don't either know, let alone care, right? Because remember, what they do is wash the body several times and put it in shrouds. So that doesn't have any, so being an organ donor doesn't have anything, that doesn't impede that process at all.
Okay. Another question for you, Rabbi Dorff. Is there a conservative movement piece of information that is let's see what the exact question was, where to find the conservative movement's advance directive?
It's on it was written by Rabbi Aaron Mackler, based upon the two rabbinic rulings that Rabbi Reiser and I wrote. And it's on the Rabbinical Assembly website. I think Rabbi Wallins can get you the link, but But you simply, if you've never seen it, by the way, on a completely, as a matter of just your education, Google Rabbinical Assembly, and then then use the Jewish Law tab, and then Committee on Jewish Law and Standards. And what you will see there are all of the rabbinic rulings that have been adopted since we went digital around 1980. And they're organized by the 4 books of the Shulchan Aruch, but you can use the search engine there to find whatever you want, right? So Rabbi Aaron Mackler wrote this, and it's on the, you can just download it for free on the from that website. But Rabbi Wallins can get it for you so that you don't have to do this.
Okay.
But I would encourage you to look at a lot of those things, because we have dealt with all kinds of things on the Committee on Jewish Law and Standards. I mean, yes, a lot of ritual things, but also a lot of ethical things and a lot of issues having to do with Jewish life generally. I mean, I think you would find really some really interesting reading if you read some of those tshuvot.
Okay. Rabbi Dorf, one more question for you. Someone asked, what about a hand transplant when it's about the quality of life issue rather than life or death and pikuach nefesh?
Right. So what we've been talking about, I mean, the obvious cases are cases in which it literally is saving a life. But that really does get extended in Jewish literature, halachic literature, to quality of life issues. So, Dr. Cainer talked about corneas. Cornea, I mean, there are people who are blind that live a completely full life, and some of them are, contribute to society much more than people who are sighted do, right? That said, if it's possible for somebody to be sighted through a cornea transplant, then, or to have their sight improved so that they can actually, so that they can actually see in the way that you and I see, then that is not only permissible, but really, again, a mitzvah to enhance a person's life that way. So yes, similarly with a hand transplant, or we were talking about face transplants before, in order to be able to function in a way that is, we're not talking about enhancement beyond normal human abilities, right? We're talking about that's a whole other stuff. That's a whole other thing, and someday we'll talk about genetics and we'll talk about that issue, right? But simply in order to be able to enable people to to function normally, then yes, that comes again. Once you die, if your hand can be transplanted, or your skin can be transplanted, or whatever can help other people live a normal life, go for it.
So thank you for the Jewish opinion. I believe that Dr. Friedman had a legal opinion on that. Dr. Friedman, did you want to share your information about that?
Well, I am not an attorney. I am not trained in the law, so I can just tell you what I am aware of. I responded to the chat, a question about whether siblings are allowed now to donate an organ to each other, minors. And in general, the answer is no, that has not been permitted, at least in my experience in these days. But the one exception to that can be identical twins, in which the potential harm to a sibling to the twin who might have been able to save the sibling's life can be so emotionally and socially overwhelming that with an appropriate independent representative to the law, to the courts, they have been allowed to do that.
Right.
Okay.
This was in Ohio at that time, and I think Dr. Friedman is right. I mean, the states are all different on this issue, and it's and there is a real concern to protect the donor, especially as a minor, right, who doesn't really have legal standing. So that kind of case is, I agree with you, is completely a matter of state law, and you have to look into it if you're even considering it.
Okay, so along the legal implications of this, there's a question about is the designation of a donor on the license, the driver's license, enough of a legal status, or does it have to be in a directive or a will?
Can I answer that one?
Please.
That would certainly be considered appropriate legal status, but it may, again, the information may not be easily accessible at the time of death. For that reason, we really strongly recommend that people now register electronically with their relevant state or with the national level registry that's at donatelife.net.
Okay, and along those lines, there's a question from a New Yorker who wants to know, should she register with the national donor registry or the state?
Please, the New York State Registry, because our rate is so low. So you can either go to our website, liveonny.org, or go to Donate Life New York. It's very easily accessible information.
Okay, and Dr. Cainer, do you have that information for Pennsylvania? Would it be
I
better
don't.
Register, okay, national or state,
I think
okay.
the links I have may have in there, the ones that I provided to Vivian.
Okay, here's another interesting question. Can someone who received a transplant during their life donate their organs at death?
Absolutely. When we have a potential organ donor, we think about each organ independently. So for example, somebody who's had a liver transplant in the past may still have a suitable heart or kidneys. So the answer is, please, everybody, including prior organ donors, should register. Yes, there's a lower likelihood that they would end up being suitable, but again, allow us to make that selection.
Okay. Here's another interesting question. Can someone who participates in assisted suicide, does assisted suicide impact the ability to donate?
Boy. And I'll tell you, that one is so ethically difficult to handle. I don't think any transplant surgeon who are the ones who recover the organs would be willing to accept them. And I'll tell you that I actually have written a piece in the New York Times that when I was responding to the question of whether a death row prisoner could opt to be a donor. And my answer was no, because that might, knowledge of that might influence the sentence that's delivered.
Okay.
Right,
Rabbi
that
Dorf,
is-
I just wanted to ask, do you want to weigh in on that issue? Thank you.
Right. In California and 7 other states in the District of Columbia and in Canada, aid in dying is now legal, and has been in California and in Canada. It's been since June of 2016. So I don't really know what the transplant surgeons are doing with that question in California, but given the fact that it is legal here, my guess is that if the person wants to die and takes the steps that are required through the law here, I would guess that because of the shortage of organs, again, that they would use the organs from such a person. But I think you're right about people in prison. I was, one of the federal commissions I was on was National Human Resources Protections Advisory Commission, which was it was in the waning months of the Clinton administration and the first 2 years of the W administration, in which we had to review and revise the federal guidelines on research on human subjects. And one of the real issues, this was after Jesse Gelsinger, a 26-year-old young man, died as a result of a research project at Penn, and Ellen Roach, a 24-year-old woman, died at Hopkins. And so we had to review and revise the federal guidelines on research on human subjects. And one of the things, and so one very large piece of that is issues of consent, informed consent, for being involved in any kind of research project. And one of the things that became clear there was that both in the prison environment and in terms of the military, there are real questions there. I mean, as Dr. Friedman just said, there are real worries in the prison environment about, if I do this kind of thing, will that shorten my sentence? And even if the person is told that it will not, prisoners will not believe you when they say that, and hope that it will. And if your sergeant says, you go and donate, right, and you're a private, you wouldn't have consent. You might be informed, but you may not have consent under those circumstances. So So in both of those kinds of environments, there are real issues of informed consent.
But I would add to that, I agree with you completely, that if a person in prison dies, brain death pathway, then they can be a donor. They may have registered previously, or their family can give the authorization.
Right.
Okay. Rabbi Dorf, there's a question about someone read years ago that conservative donations from the conservative movement, that donation must go to a specific person rather than going to an organization which will decide who to give it to. And it can only be given to a person.
No,
So
I
is
understand
that
what the question is. No.
still, okay.
No,
Very good.
that was never the case in the conservative movement. And some Orthodox rabbis say that.
Okay,
Some Orthodox rabbis say that it has to go to a specific designated person. Not all Orthodox rabbis say that, but some do. In the conservative movement, no, we have a whole system now, right? Et cetera, right? We have a whole system that will definitely guarantee, especially given the shortage of organs, that will definitely guarantee that an organ that is donated will be very quickly implanted in somebody's body.
Okay.
So there's no concern about that in the conservative movement at all.
Okay, thank you. There was a question about the directive that you mentioned, and Rabbi Ellen Wallins-Fields posted it in the chat. It's the
Right.
directive that's mentioned on the RA site. There's also a question, can you explain the testing process for suitability as a donor? Dr. Friedman, I think that one's on you.
Right.
Sure. Well, there are classes of tests that are done. First, I'll say that we do serologic blood tests to make sure that we're not or that if we know about hepatitis C, hepatitis B, HIV, that the organs are appropriately directed to patients who have those infections already, or as I alluded to before. Next, we need to do the blood type, and we need to check that twice to make sure that there isn't an error in blood type. We'll do, an echocardiogram and maybe a catheterization for the heart. We look at an ultrasound and a CAT scan of the lungs and the liver and the kidney function for kidneys. So, and there are other things depending on what the medical issues with the particular person are.
Okay, very good. I think
just maybe one more question.
I have one more to ask. Thank you, Vivian. So Rabbi Dorf, there's a question here that you said early on, there was actually a list of, whoops, lost my chat. There was a list of questions to be used when writing one's advance directive, and so that the answers could be shared among family. And would you give some information of where someone could find that list of questions?
Yeah, well, those are the questions that are built into the conservative movement's advance directive, right? Okay. In other words, it goes through, I think, if I remember correctly, 10 common scenarios. Nobody knows how you're going to die, right? But it goes through 10 common scenarios of the issues that arise as a person is in the dying process. And where Rabbi Reiser and I agree that there may be 2 or 3 possible options that you could halachically choose in regard to this, that, or the other thing, right? And so that's where those questions are that I was referring to, namely in the advance directive of the conservative movement written by Rabbi Mackler, that I guess Rabbi Wallins-Fields just put in your chat. Good.
Yes, there are lots of questions about that directive. So I know that Rabbi and Karen Belena will put that link into our materials that we send out to everyone. And Rabbi Wallins-Fields just posted it again, but we will definitely post that link in the materials. I want to thank you all for those.
If I may.
Yes.
Make this an educational thing in your synagogue, so that it can, so that a doctor can be there to explain what each of these medical interventions is and what's involved in them, and so that people actually do this as a group. As a matter of fact, here's another one of Dorf's crazy ideas. I think that a 16-year-old who gets a driver's license should fill out an advance directive, right? Because after all, a lot of the really hard cases in medical ethics were young people who died, of course, assuming that they were going to live forever, and so nobody talked to them. about what they wanted when they would die. So I think if a 16-year-old who gets a driver's license fills it out, first of all, you will then know what that person wants. But more importantly, you will give that 16-year-old the sense of the responsibility that he or she is taking in driving a car. I have yet to get a USY chapter to do this. Okay. I've even been trying to get a Hillel chapter to do this, right? But what can I say? It won't win friends and influence people. Well, it will influence people, but it won't win friends. I understand that as a program. But I really do think that it's really important for synagogues to have that kind of a program so that people can do it with a doctor there to explain what's going, what's there, what's involved in the particular interventions if they choose to have them, and a rabbi there to help with whatever the Jewish issues are.
Thank you. Those are wonderful suggestions. And I was going to say, as we come close to wrapping up, thank you. You've all been so wonderful. Everyone who presented, we've enormously more educated, at least I am, than when we started this evening. Thank you so much. Heartfelt gratitude to you. And before I call on Rabbi Ellen Wallins Fields again, I just want to echo what Rabbi Dorf said about let's all spread the news about the mitzvah of organ donation within our synagogues, sisterhoods, families, and community. Register as donors, engage our sisterhoods further, share the resources. And the recording for this session will be on Women's League website. So with that, Rabbi Wallins Fields, would you care to share your final thoughts?
Yes. Thank you, Vivian, so much for organizing this incredible panel this evening. It was really a wonderful program. Thank you, everyone, for participating. Just before I might make my final prayer, Rabbi Dorf, it's Rabbi Mackler's paper specifically that you're referring to? Okay.
Yeah.
Okay. Right. And I can get that to everybody, all the different papers, both about organ donations and medical directives. So I share a prayer with you from a book called Jewish Prayers of Hope and Healing by Alden Salovey, and I have adapted his prayer. For donor families, bless all those who have had the strength and courage, generosity, and kindness to choose life by donating their organs for the benefit of others. Bring wholeness and healing to their families. May their strength resound through the generations. May their love never cease. Let their gift serve as a call to others to follow this righteous path. Grant your blessings upon all those touched by transplant, donors, recipients, and families, doctors and nurses, clinicians and administrators, the vast network of professionals and volunteers who dedicate themselves to healing. God of compassion, may this gift of life become a source of consolation and comfort, holiness and grace. And let us all say, Amen.
Amen. Thank you very much. Shabbat Shalom. Thank you to our audience, and huge thank you to our speakers and participants. You've been beyond wonderful. Thank you, Rabbi Wallins Fields, for those final words. We're going to bring you more programs, about 4 times a year, this particular program. And anyone who has a suggestion, I certainly, would be happy to entertain that. Thank you once again, and wish you a good evening. Debbie or Rabbi, any last goodbye, and then we'll just sign off.
Just want to thank our panelists again. And actually, Rabbi Dorf, I wanted to tell you that the second Saturday in every October is organ donor Sabbath in every house of worship across North America, in every denomination and every religion. And the purpose of that is to bring information into the synagogues at that time and have your rabbi explain that organ donation is allowable in Judaism, and for everyone to fill out the organ donor card. I've brought that to my synagogue the last 5 years. And for all of you out there, if you're interested in doing it, you write to the local agency and they will send you the materials. And it is called Organ Donation Sabbath, and it's the second Saturday in October. I wanted to say thank you again to our panelists and to Vivian. This was an amazing program. And we know that you will be getting the information and you'll use those resources. Thank you for being with us.
Thank you.